we offer two trainings. We offer one called safeTALK and one called ASIST. safeTALK is a suicide alertness training. Really what it stands for is suicide alertness for everyone. And then we also recommend that HR and management level is trained in ASIST, because that's a more in-depth training. And oftentimes what we've seen to happen in organizations that we've worked with before is that someone notices the signs and symptoms, asks that person if they are having thoughts of suicide, and then brings them to their management or HR, who can then do the entire intervention. When participants come to a training, there's a few things that they can expect. The first one is the real life experience. Both Carolyn and I have a strong clinical background. We've both worked hospital, crisis shifts. Probably between the two of us, we've done upwards of 1,000 suicide interventions. So being able to bring that real life experience and really answer participants' pertinent questions allows for a richness of training.
I think you can also really expect a safe environment. Talking about suicide, it's a tough topic. And it can be potentially triggering or upsetting for people depending on their experience that they've had or the life experience that they bring into the room. So both Stephanie and I, as part of our training, is really making sure that everybody feels comfortable and everyone feels safe. So we bring in a lot of self-care techniques, which I love in our training, because we make sure that people do feel comfortable when they're there spending hours talking about a really difficult subject.
Something else we bring is the science behind everything and the current research. We're constantly looking at new research, new best practices in suicide intervention, and we're always going to be relating that to our participants.
Yeah, you're kind of always getting the most up-to-date information that you could be getting from our trainings.
And lastly, this sounds a little bit strange when you're talking about a suicide intervention, but we also like to make our training fun.
We bring a lot of fun
to
it.
It's respectful fun, but we find that because it is such a heavy topic, there is always that little bit of nervous laughter, and we like to go with it. We like to lighten up the day, and we're always so pleased with ourselves when at the end of a training with our feedback, we're continuously hearing from participants saying that this was a great changing, it was a life-changing workshop. But it was also a lot of fun for them.
But it was a lot of fun. And I think one of the really fun parts about the training is there's a lot of acting in it. We do a lot of vignettes and a lot of skits. And Stephanie puts on some really Oscar Academy Award-worthy performances during our training. So that's always a lot of fun.
Yeah.
Both safeTALK and ASIST are the gold standard in training. They're both considered the best of the best in terms of suicide awareness and suicide intervention. They're also worldwide programs. So what's wonderful about that is you can be certified in Toronto, and the certification stands up in Australia, in Europe, in Asia, wherever you go around the world. It's considered the gold standard worldwide.
If you're interested in taking ASIST or safeTALK, there's two places that you can find trainings in your area. The first is the livingworks.org website. You can find all available trainings in your region. You can also search for us as facilitators. We provide safeTALK and ASIST in Toronto and the Greater Toronto area.
You can also find our training schedule on our website as well.